Ladies and gentlemen, welcome to this next session. Sorry for the quick turnaround, but that's how you have to keep going. So we're focusing today, as you gather from the screen, and I won't take up time by introducing each individual speaker. They'll do that in a moment. As you know, one of the themes of this year is global. If it's not global, we're not that interested. We're interested in everything, but it has to have a global aspect or view to it. So I have a great panel today. They've been they're very disciplined, they're very experienced, seasoned apparently, and they know how to stick to a timetable. As our previous speaker said, it's quite worrying when you've got a huge clock in front of you here which counts down rather rapidly the amount of time. So I just want to begin by saying these are all partners of ours. These are people we know well, and we work across the world in them. So I'm going to give them each roughly a minute to say who they are, where they operate, and what they do. First is, of course, the inimitable Gisela, who I should explain, by the way, I should make an announcement, that she is our ambassador in Singapore, ran the ecosystem in Galicia here for 8 years with us, and then we've just signed a commercial agreement to do business in Singapore and Asia with her and her company, Lex. Over to you.
Okay, thank you very much. So he cut 30 seconds from my 1 minute introduction. So thank you so much for inviting me to speak here. Yeah, so before I'm a biochemist of background, so I believe in research. And then when I saw things didn't work, I really moved into management and realized why they don't work. But I was very lucky to be engaging with ECH Alliance from the very beginning as the coordinator of one of their ecosystems, and follow their philosophy when I decided to go back to Singapore, where I had been working previously. I have to say that what's happening in Singapore is really exciting, and we will talk shortly. But really what I act as, I would like to consider myself an extended branch of ECH Alliance philosophy there in Singapore, really joining the dots and really proven by actions that innovation shouldn't have borders.
Good morning. My name is Jean-Philbert Nsengimana. I work with the Africa Centers for Disease Control and Prevention. We are based out of Addis Ababa, Ethiopia. I'm a Rwandan national. Previously, I served in the government of Rwanda as Minister for Information Technology and Youth. Great being here.
You heard my talk earlier, so I'll just add that I was also the advisor to Health Minister of India between 2016 and 18. And we all have been cornered, Brian O'Connor, so we have been all cornered, to digital health. My main mission is that if you've already not started digital health, you are late. You have to start now. With that mission, I'm here. Thank you.
Hi, folks. John Warner. Despite the accent, I live in California. I've been in the US for the last 20 years. Although prior to that, I was 15 years in Australia and before that in the UK, in the healthcare system in both cases. I live in a country with a lot of change happening in healthcare with a new president, as you all know. Maybe we'll talk about that later. Thank you.
So thank you all very much. As you see, we have a great panel. What I'd like each of them to do now is to give us some indication of where healthcare and technology, etc., is in their country. What stages are you at? Because what I'm trying to discover here, are there any reinvention of the wheels inside their own country, which might be reduced by global collaboration? Things that work one place may work the other way. So maybe you could start, Giselle, in Singapore.
So Singapore is considered, we've heard it along the morning, a very advanced country. I think they actually apply from the latest panel their concept of regulation, but also as a guideline. And that really, they have an approach of really knowing themselves. So they're small, they have, of course, very capacity of investment, but also they want to thrive as the hub for innovation into Southeast Asia and APAC. So the way they do it is really following up how the reality is in Singapore, where, I mean, I'm clearly not a true blue Singaporean, but they really accept this talent. They share this talent. They invite new innovations to come and to really thrive there. And at the same time, they also provoke their companies to get a global idea and a mixture of cultures, professional and personal ones. They really replicate how their society is into the advancements of digital health. So I think they really are a country where they don't like the inaction and only talking. So they're very pragmatic, and results have to come in 1 or 2 years. So that's a very different perspective.
Rwanda gets compared to Singapore a lot, and we are both small states, except Rwanda is land-linked, not landlocked. And I had an opportunity to live in Singapore in 2010, so I see part of the comparison that it is correct, especially the type of leadership, action orientation, but also the differences in terms of the kind of opportunities that we are looking at. Some of them could be looked at as challenges. And I'll talk about 3 where I see global collaboration can really help. This previous speaker here talked about the skills gap. I know that Raj is running very successful digital academy for digital health in India. So how can Africa collaborate with India to bridge the digital skills gap that is preventing AI from making rapid progress in some parts of the world? So that's number 1. Number 2, the other opportunity we have is to provide access. Again, you talked about Babil, which had the promise of replacing primary care doctors or nurses. And we know that things like triage and optimizing the resources that we have in our health facilities can be done by AI better than any human being. And those are technologies that are available today. It's not even tomorrow. So, but that cannot be possible if we still have some connectivity gaps, and especially when the health sector is not adequately connected, when you still have some community health workers who are not connected, when you have some rural hospitals or rural health centers that are not adequately connected. So connecting the health sector is a huge opportunity, and that's personally why I came to Barcelona, because this is a gathering of the mobile industry to say, hey, let's look at this as not as a challenge, but as a huge opportunity to do good and to do well. The last one is about investment. And here is a place where you've got a lot of innovations that are at proof of concept or pilot stage. So I see a lot of money still going into trying out new ideas when you have good ideas that have been tried out that are just waiting for scaling. So this is another call to action to collaborate to scale those successful innovations, many of which use AI, but many of which don't use AI as well. I think it's important to recognize that not everything has to be called AI to be successful these days. Thank you.
Thank you. Gosh. Same question.
So let me tell you about India. How many of you have visited India? Excellent. So on one side, it is a large, beautiful country, one of the most populated country, but we are also very high on the tech adoption. Let me give you some numbers to give you a sense of, if you are talking of digital health, what India stands for. And I feel very proud and privileged to be at that time in the government. When we launched the National Health Policy, I played a role in drafting the National Health Policy, National Digital Health Mission. And when I look back at what we created, we have 759 million Aadhaar IDs, which is the electronic records for health. Out of that, 506 million are linked medical records. We also created the world's largest telemedicine platform, eSanjeevani, which has done 354 million consultations, teleconsultations. And I checked till today morning, we had done 261,000 consultations in a day. When it comes to business opportunity, I think Brian stands as a test of when we do the Global Digital Health Summit in India. Technology-wise, we showcase all the technologies from the world. I think there are best technologies available there, and there are best business models of the best. West, and as ECH Alliance, I think the opportunity here is technology solutions and business models integrating to create phenomenal business opportunities for everyone who wants to be in digital health.
True. John.
So I could talk in relatively negative terms about the United States right now in terms of where it's going to go with health in particular. Because we see the headlines and the beginnings of this administration have been particularly focused on cost. In 2024, we spent $5 trillion in the US on healthcare, and about 80% of that was on chronic conditions. So one of the first priorities in that very innovative culture is to change that. The good news, however, as I see it, is that I think the priorities of this administration in the next 4 years are going to be digital first in almost everything they do, and that includes healthcare. And I think for that, quite the opposite from the isolationist attitude that we've seen in some cases, they're going to be looking for collaboration in terms of where that digital first technology is coming from. It doesn't necessarily have to come from within America, as innovative as it may be. So I think that gives us hope and opportunity, and I think we can collaborate around that. So ecosystems in the way we've been talking about it that are innovating in individual areas within healthcare, whether that's pharma or devices or elsewhere, I think are going to be part of the story to come.
It's quite interesting just to listen to the different views and aspects and information. I hope you realize that when you look at India, as Raj has been deeply involved in this whole digital thing in India for many years, sometimes when we in the West hear a number like 759 million or something like that, we all go, sorry, did he say 759 million? The answer is he did, because it's true. We are not used in the West, particularly in Europe, if I may say so, to have that scale at all. We look at India sometimes because we've watched in television, we don't go there, etc., and we have a certain pre-organized view of it. So let me tell you briefly from my point of view. When I first went to India, which is a number of years ago, I went because Raj had invited me and promised that we would run the first digital health conference in India, in Delhi. We organized it in 3 months. To be honest with you, I had no idea what to expect. Some of the things I thought about India are absolutely true. The traffic is terrible. It is just terrible. But interesting enough, when I organized a car from the hotel to collect me at the airport, I was given a choice. Do you want a petrol car? Do you want an electric car to collect you? Think about that. That immediately struck me as, hold on, somebody here is thinking ahead. So though the traffic is terrible, and you still have to stop in the street if the sacred cow passes you, etc., etc., what struck me going into the conference was, first, the education of the people. The people we met there were educated. Raj is smart. He brought a lot of students along to a conference who were doing various exams at the time, and they were the youth. A parallel is when I went to Africa, here we had Phil, as we call him, JP, who had been the Minister for Youth. What was at the conference I went to in Kigali last year? The youth. Whereas we in the West tend to, and I don't mean any insult to anyone, because if anyone's going to be insulted, it's me. When you go to conferences, I said earlier this morning, we tend to meet the same people. Lovely to meet you again. We tend to meet the same people every conference. And I think we are more in Europe, and you may disagree, as a talking about things, as a against doing things. There's an urgency in India and Africa especially to do things, not to spend years consulting and asking, is everybody in agreement? So I'm not asking for a revolution, I'm just asking to catch up. So the key for me is, when you look at these countries, and I think both the US and Singapore and my own home country of Ireland can learn, just do things, right? Stop talking. There's too much of it. So, a couple of themes. You touched on skills, and the previous speaker, Ralph, talked about skills as well, and the lack of skills. Raj, do you want to give us a couple of minutes on your academy? I know I'm involved with you in it, but I just want to declare that interest. But just explain what you do there and the numbers that are involved, because it'll be a lesson for all of us, I think. Please.
Thanks, Brian. Firstly, I will add to the terrible traffic you said. I see them as customers. So I see that market, the roads are full of customers. You got to understand, for you it's traffic, for me it's customer traffic.
Okay.
That's how I look at it. And India has 1.4 billion people. And any business you can get 300 million customers, the size of United States. Yeah.
Yes.
So that being said, so early on, much before COVID, I realized, and I have been with the WHO writing guidelines, with the UN, with Commonwealth, that everyone was doing digital health. And the why this industry faces a lot of bloodbath is people do not understand digital health. It's very good to get excited with the top line and headlines and jump in the business with an idea. So I requested one of my boards, ISFTH in Switzerland, where I've been sitting for over a decade, that should we do capacity building in 2018. I requested them. They were very bureaucratic. We took 1 year to form a committee on capacity building, made me chairman, but I thought it's going to take ages. Digital health is not going to wait. In 2019, we launched the Academy of Digital Health Sciences. We took nearly 3 years talking to the world's 100 top leaders to create courses on digital health. And today we are the world's largest provider of digital health courses. In fact, I think they have spent $3,500 to register here. In $7,000, they become a certified digital health professional, being taught by the people who created this domain. There are courses for doctors, for CEOs, for nurses, for pharmacists, for allied health workers. And these are global courses. You can be in any part of the world, you can do these courses. And the people who teach you are the people who have created this domain. So I think we were very clear that let's people understand, like ask the question, how many of you know 5 levels of AI? Now just imagine those who are doing AI, they do not know. There is the base level of conversational level, there is the reasoners, there is the autonomous, there is innovative, there is organizational AI. If you're not taught in that sequence, you're going to hit the cliff and fall down. I think for me it is everyone should get trained before they jump and take a plunge in it. And I think very happy to help my weird friend JP, to see how can work with Africa, to train people. With Commonwealth, we are training all residents of Commonwealth on AI in partnership with Commonwealth as the academy. And I would say that look up digitalacademy.health. And if you're not trained, I think you cannot leverage the full potential of digital health. That's what I say. Thank you.
Well, that was interesting. Just for interpretation purposes, the Commonwealth, which Raj refers to, for those in the audience who are from the UK, you will remember it as the British Commonwealth. Sensibly, they changed the name of that some years ago when it became obvious that UK used to have an empire, doesn't have an empire now, which was reflected in the Commonwealth, and now they're calling it the Commonwealth. So I think there's 50-something
56 countries, yeah. In
56 countries in that, including India and so on. So populous countries, a great movement if it was utilised properly. On the skills, Phil, do you want to respond to that? Because I've been in Africa and talked to you, but you're very into skills. What's your reflection on there's something that exists. Is it transferable? Can it be utilised in India without, or Africa without reinventing the wheel?
Absolutely, and let me talk about the traffic also and the customers. There is one thing I envy India so much, is the population of Africa and India is almost the same, 1.4 billion. But Africa is probably maybe 10, 12 times bigger, but fragmented. So I envy India because it feels more like one market, 300 million customers for anything you do. But in Africa, we are just still making progress. So whenever somebody makes a mistake of talking about Africa as one country, I'm the happiest, because that's why I wish that Africa was one country, so that it can harness that kind of market. Now, when it comes to the skills, I think one of the biggest advantage that AI has brought is the capacity to translate knowledge in any language. Previously, language barrier would be a huge factor in being able to transfer knowledge from one language to another. But today it can almost be automated, and that is not just in text, but also in voice. So I would say that I consider that most of what has been developed in India for India can actually transfer quite easily to Africa, because the context is similar, the challenges are almost similar, especially the fact that we are a predominantly rural continent, and India is also the same. But I see also the need to customize a little bit. I think you took the approach of saying, let the course be developed by the people who develop those categories, those industries, which is very good. But I believe also that for every course you have an instructor, but also course assistants. Sometimes you need people who can be talking to, who are closer to the audience can relate to a bit easier. But I'm sure we can do a very strong collaboration to bridge the skills gap using, leveraging what has already been done, but also recognizing there is a lot that is also being done on the continent as we speak. It's not like people are sleeping and waiting for the solution to come from outside. In fact, as you said before, people get shocked when they come to Africa and realize that most of the preconceived ideas about what is needed, what is lacking, is actually there waiting. So there is a lot that is being done, and I believe it's more of a symbiosis that we can develop between the two continents.
Thanks very much. John, I want to ask you a question which you may or may not want to answer, right? Given the political situation in the States. It is generally thought that the health system, if there is a system, there are many, in the States, it does cost, what did you say, $5 trillion or something? $5 trillion, right? Which even if you don't translate it into your own currency, is whatever way it is, it's $5 trillion is a lot of money. There's a lot of waste in that system. We know, everybody knows that. However, no one seems to have been able to do very much in big terms about it. Do you think in this administration that is going to change, and that their focus on digital and their focus on saving money is going to have eventually, not immediately, but eventually a positive impact, right? And the second part of the question is, if that is the case, will America then be capable or willing to export their expertise from the States? Or are they saying, let China have the world?
Wow, what a question, Brian.
Okay.
I don't have a crystal ball in terms of where things are going, but I think our first challenge in terms of saving money is to reduce the fragmentation. I think when we render change of any sort, we're always looking to reduce friction as much as we can. Our friction point is we've got 50 independent states. Most of American healthcare budget devolves to the states. So that makes it not only as big as Europe in sheer scale, but twice as big in terms of complexity and regulation. So all that regulation is down at state level, for example. Huge programs like Medicaid, which cover something like 80 million people, are administered entirely by the individual states. My state of California, 40 million people, fifth biggest economy in the world, administers its own healthcare at public health level. So the complexity is, how do you get 50 states to collaborate together? In cogent ways. I think we're throwing a lot of rocks in the pool right now, cutting budgets and seeing who screams loudest. And I think some of that will have an impact, but it needs to be replaced. And I think what's going to replace it is going to be better designed processes and the deployment of technology of all kinds. It's not just AI, as JP said. It's going to be blockchain. It's going to be other digital health and device orientated technology. I think we've got great hope for that because America has really good research institutions, really good technology knowledge. So to your final point, Brian, I do think that will then be exported, because I think we'll be experimenting in the next 4 years in a way we haven't with entirely new approaches. Some will work, some will not, but that's how this goes.
Okay, I'm going to come back to Raj in a second. I know you want to speak. What's your general view, not just a Singapore view, if I can ask, but just your view on all of that?
Yeah, well, in fact, I wanted to chip in when I was seeing the questions on how it evolved. In the case of Singapore, but I will compare with Galicia very soon, one of their biggest assets is their people. And when they say their people, it means people that are actually living, working, and engaging with Singapore. It doesn't mean if you're born there. And we've seen in the panels and along all these days that there's a lot of contact between Singapore and the rest of the world. Singapore is a 6 million population, 42% of which are foreigners, so non-passport Singaporeans. And there's 53 by 23 kilometers So it's a very small island, but they always say and sell that in 4-hour flights you have 29% of the population, the world population, and 3.3 trillion of the economy. So that is an important asset, and the good thing is that they are really conscious about that, and they are really keen on identifying the skills, the good skills, bring them to Singapore, but also give them the opportunity to potentiate those skills, then bring them back. And that's how they make actually the collaborations with all the surrounding countries. I think that's a very smart way in the sense of you don't need to stay in Singapore, you don't need to live here forever, but if we help you develop, you will for sure continue the contact with the country. I mean, I'm a clear example. I want to get back to Singapore because I really had the best professional experience there in development. Now, they are born international in that sense, in the same way in other areas of Spain, for example, in Galicia, where I was managing the Galician Health Cluster. It took me a long time to say, this is a great opportunity, Asia, because we keep looking at Latin America. Nothing against that, but the way they do business there is not only the language, but actually their thoughts and how they actually do business. So now that I managed finally to convince my Spanish colleagues to actually engage and come to Singapore, they're seeing an extraordinary world that they didn't expect it. And they're seeing that, again, the trust is very important. So they want you to engage there. They don't want just you to visit as industrial tourism, which is good to have an idea, but they are really valuing the engagement with them.
Thank you. Raj, do you want to jump in on that?
Firstly, Brian,
We'll I
thank you and John for bringing up this topic of the US and the changes, because it is time for all of us as responsible global citizens to speak of things that we don't agree with. Well, I certainly respect Donald Trump for prioritizing America as America first, but there is a difference between doing right things and doing things rightly. So he's doing right things, but not rightly. I mean, there's a difference of opinion, but what I think will essentially happen is the Department of Government Efficiency, once it cracks the whip on healthcare, it will shake the very models of healthcare, not just in the United States, but all over the world. I think we will increasingly move to what we have been always talking theoretically about is the value-based care. I think that is the big shift that I'm expecting in 4 years, which will shake the fundamentals, and we won't have a scenario where the insurance CEO is shot down in New York, which was the worst scene to look at. And I think if government starts to downsize the administrative cost, technology will definitely take the front seat. So I see a major frontal role for technology in the new scheme of things.
Okay, just picking up on that point without spending a lot of time on President Trump, but rather moving on to one of the topics, you may have him in the background in your mind somewhere. Phil had said something earlier, sorry, JP, he's called JP and Phil, so just to confuse you. One of the things that struck me when I went to Africa was, and you have mentioned it, is the sheer determination. They have a saying which is Africa rising. And I was not expecting that. And what I realized was that we sometimes have this preconception of different countries, and most often it's wrong. One of the things that struck me the most was not only the youth, but the actual realization that there's so many needs, not just in Africa, but needs in Africa and other places, which are being tackled within Africa. And the skills generally, not only training skills, but the skills that are there have made a significant difference. What I want to ask, and you may or may not want to answer this, is things have changed dramatically in the 4 or 5 weeks. I talked to an organization, an American organization who work in Africa. I said, what's the situation with you? We've just lost 1/3 of our entire budget from US aid. So what effect is that likely to have, Phil, in terms of digital health and healthcare systems generally? Because suddenly you've got a donor taken away. So if you're able to answer that even diplomatically, it would be useful.
Well, thanks for the question. You always have very good words to say about Africa. Makes me wonder in this audience, how many people have not been in Africa yet?
Not been in Africa.
Yeah.
Not been in Africa yet.
Yeah. Quite a few. And one of the problems that we have to confront every day is the narrative about Africa. What is said about Africa in the mainstream media does not always reflect the realities on the ground. And thanks for the opportunity to speak in various convening by the ECH Alliance, where you gave me the moniker of the voice of Africa, which I don't mind. But I think we need more of those voices in these convenings. The question of Trump and the collapse of the US aid and the shock to the international development world and the impact on the health sector, and especially the digital health. I think for digital, what we've seen is a wake-up call to realize that most of the digital health systems that we had, we knew we had a problem with it because most of them were donor-funded. They were coming in direct competition with local innovations. There were huge questions about data sovereignty, but there is some kind of lock. We were somehow locked into that system, but now it's an amazing opportunity to break the lock and rethink how digital health of the future in Africa is going to be developed. And we see a few parameters or a few principles that we are going to be following. Local capacity is going to be extremely important. Homegrown innovation is going to raise. We are going to tap mostly into private sector investment as opposed to going for philanthropic or development investments. We are going to be a lot more careful about how we spend our money on scaling what works instead of continuing endless experimentation, which is a mode that the development sector loves so much because the next shiny thing is what they prefer as opposed to really getting your hands dirty scaling because it's difficult. So all of those are coming, are reflections that are happening. In fact, in Kigali, our good friend Amit, who's part of the ECH Alliance Council, is there. There is a conference called EHEC, and that was the opening panel. And the Minister of Health gave an example. Some of the USAID money was allowing people to do their postgraduate in medicine. About 500 students were impacted. But then they went through the budget. They went back through the training budget. They realized there were a lot of money going for short-term trainings. There is some kind of industry around short-term trainings. People get trained for the same thing more than 10 times. So they found enough money into those kind of short-term trainings that was enough to cover the long-term fundamental skills training that was needed. So it's really a wake-up call to rethink, but also review how we've been spending money and tap into different sources of money, including domestic resource mobilization, which is underused. But let's see how it plays out in the long term, but definitely a great wake-up call.
I'm just going to bring Raj in a second. One thing that when we first met with Phil here actually 2 years ago, here at this very place, he then was good enough to come to us to Health in Las Vegas, one of our flagship events, and was introduced as the voice of Africa. And he really impressed the American audience by one thing, which was put up a slide of Africa. And maybe you want to just, in a minute or two, talk through what that showed in visual terms to try to break down this wrong view of Africa. Do you want to just talk about that?
Yeah, absolutely. So there is this slide, you can Google it, it's called The True Size of Africa. 99% of Africans don't know this. Africa is massive, it's huge. All the maps that we see commonly printed, they misrepresent. It's not intentional, it's because of the projection that is used to create the map in 2D. So Africa appears almost like half of what it is actually. Because US, China, India, the entire Europe and UK, Japan can all fit into Africa. So it's a massive continent. Even myself, I still struggle to put the mind around the sheer size. That's number one. Number two, it's a very young continent. the median age is 19. Some countries like Uganda, Nigeria have their median age as below 16. So you can imagine how youthful the continent is and what this represents in 20, 30 years to come. And I think, and then the last one is Africa is rising, as you said. 6 of the 10 fastest growing economies are located in Africa. So it's another wake-up call to people who are used to the CNN and BBC only showing the images of where hunger and violence and other problems are happening on the continent without really presenting that other aspect. And the message is the future of the world is going to be shaped in collaboration with Africa, not in antagonism or some kind of exploitation, which remains the mode today.
I just wanted you to hear that because I think it's an educational thing. It's very important for us to understand any country, any market. The opportunities in Africa are staggering. And that, before I bring Raj in, I want to say this. What I've realized, and I want to make sure Africans realize it, I say this every time I go to Africa, this is not a one-way market. This is a two-way market. The innovations in Africa, they call them frugal innovation, the same in India, frugal innovations. We can spend 10 million euros developing something. By the way, it's probably been developed in 25 other places at the same time, which is really a wasteful thing. We can spend 10 million, they can spend $20,000 to produce the same thing. Not because everything is cheap, but because they have innovative minds. When you start with nothing, what you do is you manage the little you have. And this is, the mentality has been brought through to everything that's happening. And don't underestimate the digital progress they've made in places like Rwanda. I mean, it is similar to, and often is, compared to Estonia. So, Raj, we'll wrap up.
Thank you.
4 minutes we've got.
Yeah.
Right, please.
So,
Wrap up.
A guy from India and the voice of Africa sitting next to each other.
Yes, that's the idea.
I totally agree, and the point of funding that you talked about, and I've worked with policymakers, so it activates the politician in me, and sorry about that. I have always believed, and with no disrespect to anyone, that funding stalls development. You keep giving grants to people, they stop thinking how to innovate. The moment you stop it, what will happen is, why should Africa be exporting cocoa and say Switzerland has the best chocolates? Cocoa comes from Africa. Africa still remains where it is, Switzerland is Switzerland. Same with America, keep giving grants, keep saying, keep opening your economy, my companies can come and serve you. I think once you stall the grants, they will start thinking of development in real sense. I think JP has said that right. And I'm a firm believer that we should not get addicted to grants and funding, and this is a very good step from America to disband USAID. So I think we are going to benefit immensely, create real models. I'll give you, there are 2 people sitting in this room, Arman and Russell from the Grameen. I was involved in the launch of Shuki. Economically, it's a for-profit business. When we started talking last year, they created an app and a solution for women's health. 1 million downloads, 200,000 paid ones. So I think a big round of applause for people who do business and not wait for funding to be addicts to funding and grants. We have to create business models in digital health, and we should avoid that kind of system of USAID putting the hand on our head.
Just to, again, clarification, from Bangladesh, we're delighted to have them here, working with the government in Bangladesh with the help of Tobias, one of our ambassadors here. And the reality is, you look at the size of these countries, you should not look at them as basket cases as we sometimes do, rather as opportunities for genuine, truthful, transparent collaboration, not exploitation. We've all gone through the colonial times, and in some cases, maybe it's still around in a few places, but there are significant, genuine opportunities. I know we need to wrap up in a moment, although this clock really is bad for your heart rate. But so I'm going to ask the panel just quickly. John, start with you just briefly. You've given me some hope about the US, which I didn't have when I started. I'm serious. I think, as you said, there's opportunity everywhere. It'll take time though, won't it?
will take time.
So, go on.
So my quick summation is, I think the way we need to think about the next 4 years of this administration in particular is that we're going to see a more consumer-first approach, and I think that's a good thing in healthcare. Let's really go and serve that consumer. Let's stop treating healthcare like a glass bowl that we can't touch and change. I think we can do it. I think we've got the tools. William Gibson famously said the future's already here, it's just unevenly distributed. And I think that gives us opportunity to leverage technology in other sectors in a wonderful way. We're doing banking, we're booking airlines now, we're gambling online now, and we've got the skills to do all that. We can transfer those skills into healthcare. I think the US is going to lead some of that in areas like rural health, for example, which affect the rest of the world. Parts of the world are actually doing great things in rural health that we can do even inside America, because half of those chronic condition costs are in rural America. So that's where I think the opportunity lies in the future.
I think I would not worry much about US and Trump. I would say as ECH Alliance, that is a very wonderful platform to think about the new model of care, and you have the right people in the ecosystem. And I think we all have to look healthcare from the foundational perspective of what we can change. So we have a 3-tiered healthcare, primary, secondary, and tertiary. Can we have a 4-tiered to start with digital first, then primary, secondary, and tertiary? Thank you so much.
I learned one thing, that when you have a microphone, you don't give it away without selling something. So I want to invite you to join us in Kigali to continue this conversation at the Africa Health Tech Summit. It's going to be the 4th edition. We started the journey with Brian. It's going to be bigger than this. It's going to be better for all the conversations, just focused on how digital AI connectivity can enable health and allow Africa and the rest of the world to reach the universal health coverage objectives. Thank you.
Great salesman.
I'm in the wrap-up time completely, but I just wanted to add that it's important to have a plan, and in that plan there has to be the sustainability part in it, and especially that the need creates creativity, impulses creativity, and maybe you have to have a plan, but also the flexibility to be able to change fast if things go south.
Clearly, we're just about finished. Just to say this to you, if this does not demonstrate the value of the Global Health Connector, I don't know what it does. I've learned a lot today, and I hope you have as well. These are the sort of people, and many others, who are working with us to connect the dots globally. And we're going to keep going. We need you to come with us and to help us, not only to Kigali or Mumbai or Singapore or wherever, but we need you with us, because this is a movement. We need your assistance, otherwise it'll die out. So thank you very much for listening. Thank you.